Tampa. I don't need to go into all the trite stuff about how fast things are changing and what it's doing to healthcare. If you're here, you're well aware of that. What we've done is we've gathered some smart people who are operating on the leading edge, if not the bleeding edge, of this technology change that's coming to healthcare. We've gathered them together to talk a little bit about what they're doing now and what they see for the future in this technology change that's coming to healthcare.
Thanks for having me here. My name is Alfred Goldberg. I am President of North American Operations for Absolute Mobile Solutions. And unlike the other panelists, I am not in the healthcare industry. So you may wonder, why is this guy up here? What does he actually know that's going to be useful to us? For the past 11 years, my firm has been helping organizations develop and execute mobile strategies. I designed one of the first curriculums to teach mobile in the United States, and I am a frequent speaker on the topics of cutting-edge mobility. So I'm going to talk a little bit about where the industry is going from the entrepreneurial perspective, as well as who's trying to control the industry, and in the long term, where does it appear the controls will actually be set at. The industry is not new. Mobile health and telemedicine have actually been around for a very long time. In fact, in 1906, when William Einthoven created the first ECG, the hospitals would not let him take the patients out to test his equipment. So he had to figure out a way to accomplish his test in the laboratory while the actual machines were in the hospital. So he found a way to do that over telephone cables back in 1906. So you can equate that as the beginning of telemedicine. Obviously, telemedicine and mobile medicine is very useful in the developing world, where you have people who are out of reach from medical facilities and medical professionals. However, in recent years, with the advent of the smartphones and the gains they've made in the developing world, we've actually sped past the developing world. For many years, the 60s, the 70s, the 80s, a lot of the telemedicine was specifically for the developing world.